My name is Mr. Chitumba. I believe that success is a product of repetition. So experimental repetition makes us perfect. In this discussion, I am going to take you through one of the lanes that you are aware of, or that some of you are not quite so obvious about. I am going to discuss on what is called endometriosis. So I need you to listen very carefully, then we take it together. After this presentation, I am also going to make another presentation where I will show you the images so that you make an appreciation of what endometriosis is all about. Sonographers, radiographers, they scan patients on a daily basis. Some, they don't know what is endometriosis. When they see it, they don't understand how sonographically it looks like. So I have decided to take this time to explain as simple as possible what endometriosis is about and how can you see endometriosis on ultrasound scan. So let me say this. Let me start by the architecture of the uterus, or the anatomy of the uterus itself. The uterus is made up of 3 layers. We have got the central part of the uterus that we call the endometrium. We also have got the bigger portion of the uterus, the central part of the uterus, that is called the myometrium. Then we have got a thin lining of the uterus that we call the perimetrium. So when it comes to your menstruation, it is the endometrium that is involved. It is the endometrium itself is made up again of 2 layers. We have got what is called this the functional layer of the uterus and the basal layer of the uterus. So the basal layer of the uterus is the lining of the uterus that is adjacent, that is next to the myometrium. Then we have got the inner layer or portion of the uterus that is called the functional layer of the uterus. So it is the functional layer of the uterus that thickens and shades off with each period. So the thickness of the functional layer of the uterus is variable during the cycle of your period. So at times, just after a period, it will be very thin because every other part has been shed off. Then it starts again to undergo secretion. Then it grows big, it thickens again, preparing for the next period. So if you get pregnant, it means the thickened portion of the functional layer is the one that is going to accommodate the baby and then nourish the baby, and it is where the placenta is also going to develop. So now what happens, because the structure of the functional layer is so dynamic, it's a function of the time of your period or the time of your cycle. It changes the thickness with the time and again. So we have got times during which we can have what are called retrograde periods. When we have got the retrograde periods, instead of the blood that is supposed to be shed off from the endometrium or the endometrial cavity, which is the inner portion of the uterus, is shed off via the cervix and your vagina. There are times during which it does the opposite. Instead of it going into the cervix and the vagina shed outside, it can go the reverse direction. Like it goes via the fallopian tubes, then it goes out into the peritoneal space. So if it goes there into the peritoneal space, it means part of the material of the functional layer of the endometrium is going to attach itself in the peritoneal space. So what can happen is this material of the functional layer can attach itself in the mesentery. It can attach itself around the bowels or in the bowels. It can also go into the ovaries. So when it goes into the ovaries, it can then collect, the blood can then collect inside the ovaries. Because the peritoneal space is a free space, it means part of this material coming from the functional layer of the endometrium can also go around the rectum or the space around. So when such happens, because the material of the functional layer is capable of becoming thick to accommodate implantation or to accommodate the incoming baby, when it goes to an ectopic site, or when it goes in the peritoneal space and attaches itself in the mesentery, or when it attaches itself around the bowels, it keeps on thickening, preparing for the period. So it can grow very thick and then it can develop just like a mass there attached to the bowels or attached to the mesentery, just like that. The blood also, when it undergoes retrograde flow back into the ovaries, it can get encapsulated into a cyst inside your ovary. So when such happen, you are going to have what are called endometriomas developing. So the endometriomas are basically blood, menstrual blood that is now collecting inside your ovaries, and they are cysts in nature. When you remove them, then you get what is a characteristic chocolate appearance. So they are called chocolate cysts, or they've got a special name, which are called endometriomas. So on ultrasound scan, when you scan these patients, you get what is typically called the ground glass appearance. So they are going to be very fine, homogeneous, low level or mid level particles. At times they can be high level particles inside the ovarian cyst. So that is what is called an endometrioma or a chocolate cyst. So the manifestation of endometriosis, it can present itself in the ovaries as endometriomas. It can also masquerade itself as malignant tumors, as Krankenberg tumors in the ovaries or in the peritoneum, are tied to the bowels. So when someone is suspected of having endometriosis, you must take an extra effort to make sure that you examine as many structures as you can. So you might also appreciate that it's not very easy using ultrasound to examine the rest of the peritoneal space because of the bowel and the bowel contents. So it might be very difficult for you. So provisionally, what you're supposed to do is you are also supposed to recommend an MRI so that or CT so that they can visualize the rest of the peritoneum much better with a better resolution. So you must be very careful that endometriosis is one of those type of conditions that can be misleading or that can masquerade as a malignant lesion. Because if you are going to see the lesions that you see around the rectum or around the bowels or around the mesentery, You might think that uh, they are malignant lesions or they are metastases from elsewhere. At the same time, you might also mistake those for another tumor like the omental cakes. So the history at times can be very critical or pertinent when someone is being suspected of endometriosis. So endometriosis, as I said, if it occurs at different sites, different locations, it can assume different names. Like basically, if you see these lesions in the peritoneal space, you just call it endometriosis. But endometriosis is a specific umbrella term of which, if endometriosis then presents itself like a contained cyst with a typical ground glass appearance inside the uterus, then it's called an endometrioma. But there are also times during which that ectopic endometrial tissue is going to be found inside the myometrium, especially with C-section. C-section is very common nowadays. So the scar line is a passageway where the functional layer tissue can find itself, and then it gets stuck there. And when it gets stuck inside the myometrium, then it's now called adenomyosis. So adenomyosis is a special type of endometriosis whereby the ectopic endometrial functional tissue is now located inside the myometrium, and then it starts to thicken there or to grow inside there, and then you are going to see a variable sonographic features or characteristics of the myometrium. Like you can see myometrial cystic spaces. You can see that the myometrium can become very heterogeneous. You can have focal areas which are hyperechoic or hyperperfused. You can also have got the focal thickening of the myometrium. You can have lesions which can masquerade as fibroids, which are called adenomyomas. You can also have got a global adenomyosis that is affecting the whole of the myometrium, and you are going to see that the uterus itself becomes globular shaped due to adenomyosis. So adenomyosis is one of those complicated or complex conditions, because it has got variable manifestations. So you might not be able to pick it if you are a novice or if you are not experienced on how you are supposed to look for it and where you can look for it. The myometrium adenomyosis to an experienced person can be like more obvious, because you can see it in the myometrium, because the myometrium can be seen. You can use your TVS, transvaginal ultrasound scan. You can use your transabdominal with your bladder that is full. Then you can visualize the myometrium better. At the same time, if endometriosis takes place inside the uterus and then it forms your characteristic chocolate endometriomas, it's so obvious and you can pick that one easily. But when it now presents inside the peritoneal space, it's very difficult at times for you to make a diagnosis that this is endometriosis on a first glance. So it needs a bit of history. That dose of history can actually give you a pointer or a hint, especially if you see endometriosis and then you start to see other masses or lesions in the peritoneal space. It's already a sign that this could be disseminated endometriosis that is now taking place. It's very difficult for you when you see that the myometrium is clean, is intact, at the same time the ovaries are intact, for you to just call a lesion that you see in the peritoneal space endometriosis. So it's a sequence of events that needs to be followed, or that you need to cultivate to make that type of a diagnosis, or to suspect that type of a diagnosis. So at times, with the good history, if you see a person with having funny or atypical masses or lesion that you can also pick in the in the peritoneal space, it's also very nice to add the differentials of endometriosis to your list. And again, normally or mostly, endometriosis is a disease that affects women of childbearing age. During that period, that the uterus is so busy and the functional layer is also so busy. That's where the majority of cases of endometriosis are reported. But nevertheless, there is also adenomyosis that can take place just from birth. It just develops on its own. It's not a function of the age of the maternal age. It can just take place at any stage. So, in a nutshell, this is endometriosis, which is essentially ectopic endometrial tissue that is found or that is developing elsewhere outside the normal endometrium position or location. So it's an ectopic type of tissue that is developing there, and then it doesn't lose its characteristic. It keeps on its characteristic of getting thick, preparing for the period as usual. So if such happens, you can also see that when it gets thickened, the woman can also experience pain because they are preparing for their period just like that. So I believe you are following up. I will take it up again. I will show you in the next slide. I'm going to in the next video, I'm going to show you endometriosis, how it appears like, and then what are the sonographic features or findings. At times you can also see some masses which attach themselves to the ovaries, and then those ones, they are not obviously always endometriosis. They can be anything. There's also another type of a tumor or a lesion that takes place in the ovaries. If you have got a GI cancer or cancer of the bowels, they can send metastasis to the ovaries, and that condition is called Krankenberg tumors. So those are called Krankenberg tumors. So thank you so much for your time. Let's meet again in our next presentation. Once again, I wish you all well. I wish you an exciting journey of sonography in your years to come. Thank you so much.